I arrived in the US from Kingston, Jamaica in the summer of '68. My family of 6 crammed into a small 2-bedroom apartment in a 3-story walk-up in Brooklyn. The block had several children. Some spoke Spanish, some spoke English. Initially, I wasn't allowed to play with them because, as my parents said, them too rambunctious. So I could only watch them from my window. Roller skating was one of their favorite activities. They loved hitching a ride at the back of the city bus, letting go of the rear bumper as the bus arrived at the bottom of the block in front of my building. One day, there was a new girl with them. I heard the usual squeals of laughter interspersed with "Mira, mira, mira, mira," Spanish for look, look. The group grabbed onto the back of the bus at the top of the block, and as they rode down laughing and screaming, "Mira, mira, mira, mira," the bus abruptly stopped. The experienced riders adjusted and quickly let go. But the new girl lurched back and fell onto the pavement. She didn't move. The adults outside ran to help her. The bus driver came out to see what had happened and called for an ambulance. There was blood coming from her head. She didn't open her eyes. We waited for the ambulance and waited, and everyone said, "Where is the ambulance? Where is the ambulance?" The police finally arrived. An older Black American man said, "Ain't no ambulance coming." He said it again loudly to the cop. "You know ain't no ambulance coming. They never send no ambulance here." The cop looked at my neighbors, who were getting frustrated, lifted the girl into the patrol car, and left. I was 10 years old at the time. I knew this wasn't right. I knew there was something more we could do. The something I could do was become a doctor. I became an internist and committed my career for caring for those we often call the underserved, the vulnerable, like those neighbors I had when I first immigrated to America. During my early training years in Harlem in the '80s, I saw a shocking increase in young men with HIV. Then when I moved from Miami, I noticed HIV included women and children, primarily poor Black and brown people. Within a few years, an infection seen in a select population became a worldwide epidemic. Again, I got the urge to do something. Fortunately, with the help of activists and advocates and educators and physicians like me who treat the disease, we found a way forward. There was a massive education effort to reduce HIV transmission and provide legal protection for those with the disease. There was a political will to make sure that as many patients as possible worldwide, regardless of ability to pay, could get access to medication. Within a couple of decades, there were new treatments that transformed this life-threatening infection to a chronic disease, like diabetes. Now there's a vaccine on the horizon. Over the last 5 to 7 years, I've noticed a different epidemic among the patients in Florida, and it looks something like this. Miss Anime, a retired clerical worker living on a fixed income in Opa-locka, walked in for medication refills. She had common chronic conditions of high blood pressure, diabetes, heart disease, and asthma with overlapping chronic obstructive pulmonary disease, COPD. Miss Anime was one of my more adherent patients, so I was surprised she needed refills of her breathing medicines earlier than usual. Towards the end of the visit, she handed me a Florida Power and Light form and asked me to sign it. She was behind on her light bill. This form allowed physicians to document serious medical conditions requiring equipment that would be impacted if the patient's electricity was disconnected. "But Miss Anime," I said, "you don't use any medical devices for breathing. I don't think you qualify." Further questioning revealed she had been using her air conditioner day and night because of the heat so she could breathe. Needing to buy more asthma inhalers left her little money. She couldn't pay all the bills, so it piled up. I filled out the form, but knowing she might be denied, I also sent her to the social worker. Then there was Jorge, such a sweet, kind man, who often gifted our clinic with some of the fruits he sold on the streets of Miami. He had signs of worsening kidney function whenever he worked days on end on those hot streets due to dehydration, just not enough blood getting to the kidneys. His kidneys worked much better whenever he took some days off. But with no other support, what could he do? As he says, rain or shine, cold or heat, I have to work. But the most damning case of all may be Miss Sandra Faye Twiggs of Fort Lauderdale with COPD. She was arrested after fighting with her daughter over a fan. On her release from jail, she returned to her apartment, coughed non-stop, and died 3 days later. Here's what else I noticed. The data showed allergy seasons are starting weeks earlier. Nighttime temperatures are rising. Trees are growing faster. And mosquitoes carrying dangerous diseases like Zika and dengue are showing up in areas they didn't exist before. I also see signs of impending climate gentrification. That's when richer people move into poorer neighborhoods that are at higher elevation and less subject to flood damage from climate change. Like in my patient, Madame Marie, who came in stressed and anxious because she was evicted from her apartment in Miami's Little Haiti to make room for a luxury apartment complex whose developers understood that Little Haiti would not flood because it's 10 feet above sea level. An undeniable, clear, and consistent warming trend is underway. A health emergency even bigger than HIV/AIDS seems to be in the works, and it was my low-income patients that were dropping clues of what it would look like. This new epidemic is climate change, and it has a variety of health effects. Climate change impacts us in 4 major ways: directly, through heat, extreme weather, and pollution; through the spread of the disease; through disruption of our food and water supply; and through disruption of our emotional well-being. In medicine, we've used mnemonics to aid our memory, and this mnemonic, heat wave, shows the 8 significant health effects of climate change. H, heat illnesses. E, exacerbation of heart and lung disease. A, asthma worsening. T, traumatic injuries, especially during extreme weather events. W, water and foodborne illnesses. A, allergies worsening. V, vector-borne diseases spreading, like Zika, dengue, and Lyme. And E, emotional stress is increasing. Poor, vulnerable people are already feeling the effects of climate change. They are the proverbial canary in a coal mine. Truly, their experiences are like oracles or prophecies, the guiding light for us to pay attention that we are doing something to our world first that's hurting them first. But in a matter of time, we are next. If we act together, doctors, patients, and other health professionals, we will find solutions. We have done this with the HIV crisis. There was thanks to the activism of patients with HIV that demanded medications and better research, and the collaboration of doctors and scientists that we were able to control the epidemic. And then it was thanks to international health agencies, NGOs, politicians, and pharmaceutical companies that HIV medications became available in low-income countries. There is no reason we can't also apply this model of collaboration to address the health effects of climate change before it's too late. Climate change is here. It's already damaging the health and homes of poor people. Like my patient Jorge, most of us will have to work, whether rain or shine, cold or heat. But together, these patients and their doctors, hand in hand with some basic tools, can do so much to make this climate transition less brutal for all of us. These patients inspired me to found the clinicians' organizations to fight climate change. We focus on understanding the health effects of climate change, learning to advocate for patients with climate-related illnesses, and encouraging real-world solutions. A recent Gallup study showed 3 of the most respected professions are nurses, doctors, and pharmacists. So as respected members of society, we have amplified voices to influence climate change policy and politics. There is so much we can do. As clinicians, our many patient contacts allows us to see things before others, and this puts us in an ideal position to be on the front lines of change. We can teach climate-related illnesses in our health professional schools. We can collect data on our patients' climate-related conditions by making sure there are billing codes to identify them. We can do climate-related health research. We can teach how to have green practices in homes. We can advocate for patient energy needs. We can help them get safer homes. We can help them get necessary equipment in those homes when conditions worsen. We can testify in front of lawmakers as to the findings. And we can medically treat our patients' climate-related illnesses. Most importantly, we can help prepare our patients mentally and physically for the health challenges they will face using a model of medicine that incorporates economic and social justice. This would mean Miss Sandra Faye Twiggs with COPD, who died after being released from jail after a fight with her daughter over a fan, would have known that the heat in her apartment made her sick and angry and seek a safer place to go for cooling. Even better, her apartment would never have been so hot. From the poor, I've learned their lives are not only vulnerable, but are stories of resilience, innovation, and survival. Like that wise old man who loudly spoke truth to the cop that summer night, ain't no ambulance coming, and compelled him to deliver that little girl to the hospital instead. You know what? Listen up. If there's going to be a medical response to climate change, it is not going to be just waiting for an ambulance. It is going to happen because we, the clinicians, take the first step. We make so much noise that the issue cannot be ignored or misunderstood. It is going to start with the stories our patients tell and the stories we tell on their behalf. We're going to do what is right for our patients, like we've always done, but also what is right for our environment, for ourselves, and for all the people on this planet, all of them. Thank you.
Good morning. Good morning. Antoine Williams, co-founders of the Advancement League organization that is extremely dedicated to career development and community impact. As you all know, every year we host the Young Health Leader Summit. And today we have the amazing privilege of talking to Dr. Cheryl Holder. Good morning, Dr. Holder.
Good morning. Good morning, Antoine. I'm glad to be here.
Absolutely. We're glad to have you. We're all big fans. We've all seen your work, have been admiring your work, and even right before you came on, rewatched your TED Talk about climate change. So for those of our members and followers that haven't had a chance to meet you or and may have just seen the TED Talk, can you give us a little quick introduction to how you're helping the world be better?
Thank you. Well, I have to say, I go all the way back. I've been out here in this world a long time as a physician. I graduated in 1984. So I'm a doctor, I'm an internist, internal medicine. I've been practicing in my community here in Miami since I left Harlem Hospital in 87. I came to Miami as part of my scholarship to pay back 4 years of medical school, pay back in an underserved community. And I was fortunate enough to get Miami. Never been here, no connections. But when I got here, was in the heart of the HIV pandemic, poverty, just a lot of issues that I wanted to work with. And I worked in a community providing care, providing basic primary care, because that's what I believe in, improving the health holistically of that patient and then extending it to the community. And in that, as a doctor who I can take care of for generations, I hope to put that understanding of what is health and understanding that it's more than just what happens to this physical body, but it's what the society has done. I said in my talk about where you live, where you work, where you play, and in many ways, that's the example I give. It is those dynamics that really drives health. And so that's what I set out to transform and improve for my 30 plus years. Now I work in academia. I switched to academia from doing a community health center, leading it for many years, developing programs that addresses the holistically how a patient improves. I switched to academia to try and bring up the next generation and also
develop a way of bringing the social determinants into medical schools that we incorporated in how patients are evaluated. So that's what I've been doing for the last 12, 13 years, teaching medical students, bringing up the next generation. And most recently, I became the Associate Dean of Diversity, Equity, Inclusivity, and Community Initiatives. Again, with the basic mission that I've had for 30 plus years is creating that society, that community where people can really grow and thrive. And that's what I'm doing with diversity. My climate is just another avenue because it is the existential threat. It is what we see for the entire planet that could destroy us as humans. And I saw it happening with my patients. As you saw in the TED Talk, it's not something that was in the future, but for poor Black people, what I've been taking care of for years, it is now, it is killing us now. It is affecting our youth, it's affecting our pregnant women, it's affecting the next generation, it's affecting our people now. And so many people weren't talking about us. They were talking about the polar bears and talking about everything else as if it wasn't happening. And so that's really what triggered my move, that we have got to speak up now, and the solutions can't avoid poor people anymore. And so that's where I am with my career, and pushing communities and pushing folks to realize that we are under threat again, as we've been constantly in our existence, especially poorer people, Black and brown people.
Oh, so much work, and you continue to inspire us. And I think you echo the sentiments that the work does not stop. We like to believe that the folks that we bring together, members of the Advancement League, friends of the Advancement League, are not only kind, but we are results driven, and we want to be inspired and actually do something about these issues. So with that in mind, you said a couple things in the TED Talk. You said that, if we act together, doctors, clinicians, pharma administrators, and so on and so on, that we can drive great change. And you connected that statement to the response to the HIV epidemic. Have you seen any other signs of hope, or are there any organizations that are currently doing great work that we as the Advancement League should also collaborate with?
Yeah, there's no other way of effecting real change other than together. It's HIV, it's civil rights, it's everything that we've ever seen that we've moved change. It can't just be politicians and folks saying we're going to do this. If you don't have your activists out there screaming and yelling and protesting, and you don't have your administrators, everyone else working together for the common message. And that's what politics is all about. So politics is getting that common message and moving that common message in individual action, in group action, and in our country, taking it to the vote. So there are many, many organizations that have been moving this for more years than I have. And I think one organization that is often not spoke about enough is the National Academy of Advancement of People, NAACP. NAACP Environmental Justice Movement predates the climate movement. And when we think about it, that environmental justice, if we had recognized what the NAACP had been doing for many, many years in environmental justice, we would be way ahead of climate change. Because where did the pollution come from? It came from the Industrial Revolution. When we talk about environmental justice, had we cared about the people who were dying from all the pollution that is often placed in Black and brown communities, we wouldn't be here, because we would have listened when the NAACP spoke up about people dying of cancer, lung disease, the lead issues, all the issues that has been talked about for many, many years for NAACP. So I give NAACP as a group that needs to be supported in the environmental justice work and not separated from climate change, because the root of climate change comes from all that industrialization and all the pollution that happened in our backyards. And so I have to say NAACP is a group that needs to continue to speak about environmental justice, because that's the root of what's happening to us, and that needs to be supported. They're in the medical world, the Medical Consortium of Climate Change. That's the overwhelming group out of George Mason that has pushed to develop small organizations in every state. In my state, the Florida Clinicians for Climate Action, there's Georgia Clinicians for Climate Action, there's North Carolina Clinicians for Climate Action. That's bringing all the clinicians together under individual states to move the states for the specific impact that happens in our state. Now, like Florida, heat, sea level rise, those are big for our state. In other states, it'll be tornadoes. In other states, it will be fracking. It will be other things that's pushing the impact from the climate. So that's what we've done. So everybody out there, you can Google your climate action, Clinicians for Climate Action organization, and get supporting the climate and health initiative, because we also bring equity as a central part. The other groups, Climate Reality, Moms for Clean Energy, there are many when you Google, and you'll see it for every area. But we encourage you to look at what's going on for your state organizations and work as much as you can within your state, because what big thing happened, and we just signed a bill, and Biden is about to sign Friday, the House of Representatives passed it, is the IRA, Inflation Reduction Act, but it is the biggest bill in climate impact that the United States has ever done. We need an urgent response because we only have about 30 years to stop the rise where it is to the point where we will not be able to return. And we've got data that the Arctic is melting 4 times faster than we anticipated. That means sea level rise is going to be upon us. And states like mine, where now there's a part of our state called Homestead, which with climate gentrification, which moved a lot of the Black population out of the high ground and poorer communities down into 1 feet above sea level area called Homestead. That area now is under threat as this area goes higher. So you have to start working and looking at your states, because that's what has to have an urgent response now. And the states have got to get into these dollars that was just signed. $60 billion is coming to the states to rectify some of the past damages that we know has happened. And it's $60 billion, that's just for equitable responses. And that's just for the poor communities. So we need everyone to get involved in their state so the money is not distributed to projects that are not going to really help our communities. Because we've seen this happen over and over, where we fight for dollars and the money gets sent away to other projects. So this is the perfect time, and I'm so glad you have me on, because this is the perfect thing that we've been working for so many years, to get the government to act. And we finally got money to be able to do these changes. But now if we don't hold our politicians accountable in the states, we're going to lose that impact. So like with the money coming in to look at highways, why are highways so important? Most poor communities, when the highways were built, where do they put those roads? Right in the heart of many poor Black communities. No surprise, asthma rates skyrocketed. Black maternal health worsened. We saw how the pollution and dehydration drives preterm labor. So if we're going to improve our transportation, decrease pollution, one of the things that we should be pushing for is getting those school buses and transportation electrified. Because when they drive around our poor community, they spew out diesel fuel in the Black communities. So there are many things that we can act on now with the money that's coming from the federal government, but it means getting involved. Who are you voting for? The politicians? If they don't have a clean energy, they don't have climate change in their platform, and they're not accepting that poor people have suffered and our responses should center the poor and have an equitable response, they don't deserve your vote. So we are at a perfect time for our society, our communities, to get with these organizations, NAACP, Urban League, any of your disaster relief preparation groups, because disasters is what we have to prepare for. How are we preparing for disasters? Are your communities, any community group that's saying, I need to help poor people get some resources so when they have to evacuate, there are roads, there are buses, there are foods, there's water. These are the things that we need activists and people on the ground screaming and voting and participating in changing how we respond and centering a lot on what we can do to help the least among us. Because in helping the least among us, we help ourselves because we get urgent response.
Love that. I thank you for those sentiments. I like to think that our members will not only hear your call to action, but answer your call to action. We truly believe and share this sentiment with you that the future of health is together. Over the past several years, we've seen social determinants of health become a buzzword and an actionable buzzword. So we, really shape the mindsets of our leaders to say, hey, food is health, housing is health, happiness is health. And I think on the heels of the work that you're doing, we have to add that climate change is health.
It's your ultimate environment where you live. I mean, we live on the planet Earth. If your planet is dying, I think it's only natural to know we are going to be part of that death. And not just us, but animals, insects, birds, our trees, it's everything. And so it's the ultimate test of social determinants of health.
So I jotted down the list. We have the list of organizations that are doing it well. We're moving into action, and we're having more impactful conversations, much like these at our Young Health Leaders Summit in Raleigh, Durham, North Carolina. It's looking to be March 2023. So we have to get you there, and we have to figure out how we get more action, energy, and funding behind this.
Thank you.
Appreciate you, Dr. Holder. Thank you for the time. And with that, we'll close it out.
And I'm a doc, so I can't stop by being a doctor. It starts with you, with your health. And the great thing is that every climate solution is a health solution. So when I tell you eat half your plate vegetables, that's a climate solution. When I say cut out that red meat, that's a climate solution. Get some exercise, that's a climate solution because it means you don't drive. Cut down that fossil fuel use is a climate solution. So our personal health, improving it is also a climate solution.
Say no more.
Stay alive. Stay alive. Thank you so much. Bye-bye.